My name is Justine Komunyena Tumusiime. I work with PATH as a research coordinator, and my project is about assessing menstrual health and factors affecting menstrual health in Uganda. So we know that menstrual health has become a major challenge for women in workforce. And in 2021, WHO made it or included it in the Sustainable Development Goals. And came up with different indicators like awareness of the menstruation, materials, availability and access to materials, and washrooms, and also ability for the women to participate in different activities during menstruation. So those are some of the indicators. So in Uganda here, the government has taken this one seriously, especially in schools. They have really enforced menstruation for school within the school health. But what has really not happened is looking at workplaces for women. We know that this could also be a challenge. As much as they're working and get money, they can take care of other things, but we still have to find out whether there's a way this menstruation health or challenges affect the output of the women. So I took a journey to identify factors that affect women during menstruation, and specifically nurses and midwives at their workplaces. So I interviewed 8 midwives and 8 nurses from both public and private facilities about their menstruation experience. And what I learned is that these women work for long hours, over 24 hours without change, and they do not have access actually to emergency menstrual materials, and yet they are exposed, or emergency menstruation flows are very common in this category given their stressful work. So during this menstruation, like everyone knows that a woman is not as normal as she should be. So there are some things that need to be put in place, like access to water, restrooms, to be able to refresh when someone gets an emergency flow. Also, access to painkillers. Most of the facilities right now, we learned that there's a protocol, there's a bureaucracy where nurses have to go through to access those provisional menstrual materials like cotton balls, even painkillers, to access a prescription to have them. They also, the workload still high for them. For a woman who is experiencing backache and all those other pains, is still a high workload, which they think if they could get a day off their work, that would be really very refreshing for them. And we also engaged 4 male nurses, just asking them about the experience of nurses, their female counterparts, especially during menstruation. And they mentioned, given the cultural context of our country where menstruation is kind of private, they mentioned that women do not open up, but they just, as men, they have lived to learn when someone is experiencing menstruation challenges, and they have always been there to support. So their cry out was really, if nurses can be supported to be off duty at least one day during their menstruation flow, this would help them refresh and also improve their work. So in terms, this work is going to be done into phases. That phase, we identify the gaps. And so in terms of my ask to the people listening to me, is to support the nurses, support the sensitization campaign for nurses, where they can come up out of their silence, break the silence about these challenges that they face at their workplaces, and also push and advocate for policy change to include at least a maximum menstrual package, emergency menstrual package for nurses at workplaces where emergency flows, menstrual flows happen regularly. And also to have at least advocate for tax waivers over the sanitary pads, and this will make the owners of different hospitals and facilities afford these materials to avail them to their workers. Thank you so much for listening, and over to you.